So today I have a special guest again on my podcast, and her name is Linda. And we know each other from a training that we did a while ago around intimacy, embodiment, trauma. So we've been seeing a lot of sides from each other in that year. But the side that is stuck most with me is the woman that's very daring, very strong in her field of work. And I'm really excited that she's here to talk and share her expertise and her knowledge on male sexuality and cocks. Hey, Linda.
Hey. Wow, quite an introduction there.
Yeah, I learned so much. I also went to some of your workshops. You invited me, and that was such a gift. And I'm still using everything that you showed there and that you shared there in the bodywork sessions and the sessions around genitals that I give now as well. A similar kind of session, but with my own twist. But I know that you do it in a very particular Linda way, and I just have always loved hearing you talk about it. So, yeah, let's talk about cocks.
Yes, please.
But I just introduced you, Linda, but how would you introduce yourself today? And how would you describe the work that you do?
Wow. The question of who am I today in this moment and what do I do? So difficult, but I'll try. So my name is Linda. I live in Stockholm. I have been working with sexual development for the last 10, 15 years, approximately. For the last 5 years, I mostly work with men and male sexuality and the problems that they can have. So mostly erectile dysfunction, premature ejaculation, pains, aches, fear, shame. So what I call it is that I say it's therapy through pleasure. That is what I mostly do. And then also I coach people to regain a better sex life, I would say. And I work with couples as well that want to come closer to each other and learn how to communicate better and explore pleasure together.
I think you did a really good job introducing yourself. Is there more? It looks like you're...
I don't know I guess if you would ask me again, I probably would say something completely different. But this is what I do most of the times.
I actually wasn't aware that it was so broad. And I love that you use the word sexual development.
Yeah.
Therapy through pleasure.
Yeah.
Lovely.
But I want to say that sometimes it's not so pleasurable. Even though you have a sort of intention, like I want to reach more pleasure in my life, but then maybe you have so much tension in your pelvic area that you have to get a tension release first before you can experience more pleasure.
Definitely. So I'm going to ask you a question that I don't like getting myself.
Okay, interesting.
But how does a session usually look like?
I never know.
Yeah, okay. It's the same.
But even though there's always an intention with the session. For example, if I have someone who comes to me for erectile dysfunction, then the intention is to, find out what's the problem underneath all this. So we always talk, and then there's always some kind of body work where I help the person let go of tension with my hands.
So it's a hands-on.
It's a hands-on session. And then there is almost always some sort of emotional release that's happening. And then in the end, we always talk. about the session, what emotion came up, some insights, maybe memories.
Mm-hmm.
So we always sort of integrate what happened during the session.
Beautiful. I invited my audience to inspire this episode with some of their questions. And yeah, I got really nice replies. And what stood out for me was that a lot of the questions were from men about size and what women prefer, and if it's possible to influence the size through a bodywork session. And then moreover, is that even an okay intention, was the question. Can I have the intention to have a bigger penis? What's your view on this?
Yeah, but I mean, everything is okay, I would say. If you are having this intention of wanting to have a larger penis or smaller penis or a bigger girth, I mean, that is your intention. Why make it wrong? But then again, maybe ask yourself, why are you having this intention? Is this important for your ability to feel pleasure? Or is it a mind thing that you're thinking that you have to have a bigger cock so people will want to have sex with you? So why do you want to have it bigger or smaller? Or is there a problem actually coming with it? Because people have micro penises, and sometimes that can be really difficult. And sometimes people have really large penises, and then it's difficult to have sex when it's embraced by another body. So yeah, size do matter, if it's too big or maybe too small. But too small for what? Or too big for what? I often say that if you meet someone that you want to have sex with, and it's a perfect fit, and you and the other person, you fit together, perfect. I mean, then there's no problem. But if you meet someone where there's no match, whether it feels like there's pain or it's not, you can't have sex. I mean, yeah, maybe then there is a problem. Or you want to change yourself, but maybe you don't have to. Because I would say that it's more, for me, what's important is the pleasure that comes through your genitals, your ability to feel the pleasure, to explore the pleasure, both for yourself or together with someone else, or several people. So it's possible to make it a bit longer. The thing is that you have to do certain stretch exercises, and you have to keep on doing the stretch exercises, because when you stop, it's gonna sort of grow smaller again, or shorter.
Yes. And maybe it's nice to explain a little bit how it is possible to stretch a cock. And for me, when I learned about this years ago, I didn't know that there was a big part that's more on the inside, like the penis. There's an internal and an external part. Do you want to, in your own words, explain a little bit how that works with the tissue and the tension and the...
Most of the times, there's actually a lot of tension around the root of the cock. But that's not where the cock ends. If you feel underneath or under the balls, you can feel that the cock is sort of going inside the body underneath, with the perineum and that. So if you would decide that you would go for an operation, for example, they are cutting the ligaments that attach the cock to your body. And that makes it sort of just come out a little bit more from your body. But when you get an erection and you have cut those sort of cords, it's going to make it more wobbly. you're not going to have it you can't really control where it goes.
Mm.
So the ligaments, the cords, you need it.
Mm-hmm.
So it will be more fixed to your body. But if it's necessary, you can cut those.
Mm-hmm.
Mm. Now, so what I do when I teach people how to stretch their genital area is that I show them how you can let go of tension. Because normally there's a lot of tension, where I said, around the root of the cock, and the ligament have the tension as well. And the whole fascia, that you have it all over your body, including your genitals.
Mm-hmm.
So when you stretch, you get the fascia more flexible, and the cord, and you also increase the blood flow. So that will also make the cock increase in size.
Mm-hmm. Mm. Yeah. And this is true for all bodies, regardless of gender.
Yes.
But I've definitely had from multiple people responses of a feeling of almost like their genitals are bulging out more, or like coming out more after some sessions of stretching and deep massage.
Yeah.
It's exciting.
It is. My favorite topic.
Yeah.
Some people call me the cock specialist. I kind of like it.
Yeah.
But I also, I actually have specialized in cocks. Mm-hmm. But when I was working with Peyronie patients, and that's people that have a crooked penis.
Okay.
So that's what I specialized in.
Mm-hmm.
And not just, a bend one, but actually it's completely crooked.
Okay, I haven't seen those yet. I'm looking forward.
Yeah. But you can only see it when it's erect.
Okay. I was opting a bit to ask more about that, but I'm going to go to something else. Yeah.
Okay.
Unless you feel very excited about it. Would you like to say a bit more about this?
Do I want to say more about Peyronie's? Maybe. This is kind of my favorite topic as well.
Yeah. Yeah. Please go ahead.
So Peyronie's is something that you get from an injury. If you're having sex and you hurt yourself, and then you get this it's not a disease, but it's called Peyronie disease. So where you hurt yourself, where this scar tissue grows during the next 6 months after you hurt yourself, that is what causes the cock to bend. Mm-hmm. So the scar tissue itself makes it really tough and rough and really difficult to anyway, it's difficult to have sex when you get the crooked penis.
So this is after like a serious crushing or bending rapidly of the penis.
Yeah. So I've heard thousands stories on how they did get hurt. Driving a motorcycle, riding a horse, carrying a kid, having a kick on your cock, walking into a table's corner. It's like you can hurt yourself in so many different ways. But most of the times it is during sex.
Okay.
When your cock is sort of semi-hard and you're having sex, and then there's this, you hurt yourself during sex. So, and also what we found that if you also have the Viking disease, which is like crooked fingers, if you have that disease in your family, it's more likely that you will have an increased risk to also receive it in your cock if you hurt yourself.
Okay. So is this when, sometimes it happens when, with a semi-erected cock that you pull out a little bit too much, and then when you want to go in again, is that the kind of accident that you're talking about?
Yes, one of them.
Yeah.
Or I've heard them all, I believe.
Yeah.
Or if they want to carry someone, or if you're not strong enough to keep on carrying that person while you're having sex and you drop them.
Okay.
Yeah.
Okay.
And or if you miss where you're going and you accidentally sort of hurt yourself going to the mattress instead of where you want to be.
Yeah. And in that case, you are stretching and doing body work on the tissue, on the scar tissue, and
yes,
just inviting more blood flow there and healing of the tissue.
Yeah.
Okay. I'm learning a lot.
Yeah.
Yeah. In working with people around genitals and sexuality, what I often see is that there's a lot of pressure on how our body or our genitals should perform. And if there's, you see people all the time also with erectile dysfunctions or premature ejaculation. And in my audience, there's also quite some people with those issues. And I've also been writing about the difficulty of having a cock sometimes, and they have to be hard instantly when you want to, but they can't be hard in certain situations because then it's offensive or threatening. You have to stay hard as long as possible. I also met a man recently again. He knew all the tantric practices and self-pleasure practices to work on his premature ejaculation issue and erection problems. And yet there's just so much pressure on needing to fix himself that it feels like a training, and the relationship with his body is getting messed up completely. So it helped so much to just be with him and little by little allow his cock to just be however hard or soft his cock wanted to be, and play with the idea of teaming up with his genitals. Like we're a team. You're not we're not on different sides. What is your perspective in working with so many people with cocks over the years on the pressure, and how do you address that also in your sessions and in your work?
Thank you for the question. I would say that performance anxiety is mostly what fucks people up. So you have to. No, you don't have to, but if you want to get to know your cock a bit better and become best friends with it, that really, really helps. So when people come to me and we do a session, I tell them that this is a place where you're not allowed to perform anything. Your job is just to receive my treatment or my touch, and to see if you can be curious about what wants to happen in the moment. We're not going anywhere. What happens, happens. If the cock reacts from being touched, it reacts. If it doesn't react, that's fine too. So mostly it's a thing, like a mental thing. It's a stage to get over this learned behavior that, oh, now is someone touching me, I have to perform now. It has to be erect. I have to be hard. No, you don't have to anything. And you're not in control here. Just so you know, you can't control how your cock wants to react. You can't. You just face it. It's not up to you at all. You can't. But what you can do is, like, you can give the cock the best förutsättningar. I can't find the right word now, but sort of you can help it by stretching it or doing a daily cock yoga that some people call it, just so you know that the function is totally fine. So you can trust that everything is good. But then you have to let it go, because it's not up to you.
I can feel the relief in my body just listening to you.
And mostly it's also the thoughts that, I want to, I need to, this is something that has to happen now.
Yeah.
Because I want it so much. I want to be with this person now. But one thing that has helped me when I meet people is that I know that if I'm not ready, I mean, the person that I have sex with is probably not ready either.
Yeah.
So the cock is going to react to the other person as well. So it's not about you. It's about you and the people you're seeing or meeting.
Definitely. And it's exactly the same for people with vaginas. Like we have erectile tissue everywhere. It's just inside. And our pussies are not always wet when we want them to be wet and open. And sometimes there's an emotion that needs to be expressed, or there's something in the way, or whatever it is that I need to feel connected and close and ready. I'm not going to be able to force my pussy in anything. And it's going to be a sign that either me or the other person, or just both of us, like we're not there for whatever reason. And it can be frustrating or raise questions of like, oh, is something wrong? Of course.
Yeah. But, stress is the worst enemy for the erection.
And I would say curiosity is the cure.
Yes.
It's so lovely to just, what's here now? Like, yeah.
Yeah. And just being present in the moment. Like, that sounds easy, but sometimes you need to practice being present in the moment.
Definitely. So, I want to jump further to talking about orgasms. I got the question, what other orgasms are there next to the ejaculatory one?
Wow.
They talk about non-ejaculatory orgasms, and I get a lot of people that want to learn how to do that. And then there's a question, is there a difference between non-ejaculatory orgasms and energy orgasms or full body orgasms? Yeah, I have my own thoughts on this, but I'm super curious what you would say and what your experience is.
I'm a cock expert, but I'm not an expert on orgasms.
Okay.
No, but I would say, I don't know if you have experienced sort of a squirting orgasm, but I would say for me, there's a big difference between ejaculating or sort of having the squirt orgasm, but it's not the orgasm, it's the squirt. And then you can have the orgasm. But if they are combined, it can be magical. But it's sort of the same thing for people with a penis, that they can ejaculate. And I mean, it's an ejaculation, but it's sort of not special at all. It's just, it is what it is. And then you have the orgasm. And if they are combined, it can be magical. But people tend not to know that there is a difference between these two, because they seem to happen simultaneously. But sometimes they don't. And sometimes you ejaculate, and sometimes you have an orgasm, or sometimes you have them together.
And I would say it's just fun to learn to feel the difference and to have a choice and to explore finding, like, how do I get one and how do I get the other, and what do I need to combine them. And I think this is a big topic in the tantric world. I saw you wanted to say more.
Yeah, but I've heard people that are practicing this. They're giving themselves self-pleasure in a very slow kind of way. Not the same thing that you do when you just want to have a jerk off and watching porn and sort of you're over with it, or you give yourself time and let yourself explore. And when you notice that your arousal is really coming to a high, maybe you slow down even more and breathe, and just breathe and try to relax. And then you can continue again. So give yourself the pleasure. see what happens. And when you come to this high again, slow down, breathe, take it slow. Sort of, you do this for a longer and longer period of time until you decide when you want to orgasm.
Yeah. And I think the key in the technique that you're describing now is when you pause and slow down and do the breathing when you're at the peak. It's not a matter of numbing and suppressing and stopping. Now I need to stop. Now I need to stop. It's a matter of like receiving everything that's there and relaxing into the arousal, not stopping it, but letting it maybe even expand in the stillness.
Exactly. And doing the cock stretching or the genital yoga, it's going to help you to be able to hold more of this sexual energy. Because if you have a lot of tension in your pelvic area, you're probably going to ejaculate quickly because there's so much tension there. And when you let go of tension, you can hold this pleasurable energy for a longer time.
I get the image of it being trapped there. It can't move. It's just
it can't move.
Like a bomb inside. Yeah.
I just have to go.
Yeah.
And when you practice, you can see if you can start to feel the pleasure in bigger parts of your body.
Lovely. Thank you for explaining that technique. I think one thing that I'm careful with when people ask about this is that it doesn't come from a dogmatic idea that ejaculation is bad or wrong or not spiritual. I'm just curious, and I'm just such a fan of expanding our pleasure range and learning new ways of enjoying our bodies, and that's why I'm always going to encourage to investigate this and try out these techniques, but not from an idea that I can't ejaculate anymore. It's wrong.
Yeah.
So that's just something I wanted to add to this story.
Yeah. Thank you. Thank you. You know, to me, that's just how it is for me. So that's normal way. So I forget to sometimes talk about it, but because I never want to make people wrong. And I have made myself wrong. When I first stepped into the tantric community and tried to learn more about Tantra, I made myself wrong for wanting to have a sort of clitoral orgasm because I wasn't supposed to. Yeah. But no, it's like, nah, fuck it. It's pleasure. I mean, if I want it, I want it. I can have it if I want to, but sometimes I don't want to. And I can experience pleasure in so many other ways. And when you were asking how many other orgasms are there, I mean, there's so many other orgasms. I mean, you can have, just by touching your breasts, whatever kind of genitals you have, you can have an orgasm through that. You can have orgasm through breathing, through peeing. I don't know, you name it.
Yeah. And I also wanted to say, like, for me, it has given me so much insight to be able to squirt and know how that feels, and exploring my G-spot area and getting the experience of really wanting to come and getting that, like, almost like, oh, this is what jerking off can feel like. And sometimes I just really want that. Like,
and why make yourself wrong for it?
Yeah.
I mean, enjoy.
Yeah. But that was definitely a new feeling for me. I've always been rather of the slow kind, or the, so it was wonderful to, oh wow, this is how it is. Like,
if you want the cake, eat the cake and enjoy the cake.
Yeah.
And why make yourself wrong afterwards you had the cake? I mean, just enjoy it.
It's funny that you're making the analogy with the cake, because I just come from a family New Year's dinner, and it's literally with cake the same thing, where
Okay.
up front people are saying I shouldn't eat this, and then while it's like, oh, it's so bad, but it's so good, and then afterwards I was like, I ate too much of it. It's like
exactly the same
it's
thing.
exactly the same thing.
Yeah. And sometimes I even use the analogy about table manners. When people don't know how to handle the arousement, they get too greedy or needy because they don't have the table manners. Because I mean, they are so hungry, maybe even starved for touch or sexual pleasure. They don't know how to handle it. So table manners can be a good thing to practice.
Yeah. There was one man that emailed me about his struggle of feeling like his sexuality is wrong instead of something he can celebrate or enjoy. And he wrote from, that male sexuality is often pictured in society and in the media as aggressive or threatening, disrespectful or inappropriate. We already mentioned this a bit before. And I think, this is true also for people with vaginas. It's just sexuality is like someone who's really sexually empowered. It's just intimidating for a lot of people. It's very powerful. But there's something about male sexuality. And I definitely grew up hearing many, many times that I shouldn't trust men and I should be careful at all times. And even with people that I know well. And kind of jokingly, they've told me also it would be great if you come home with a woman, like they're and
interesting.
I don't know if you've had any of those messages, but I noticed that it's still sometimes with me, and I have some female friends that recognize that when I'm meeting someone new, I know that there will be undressing involved, that there's a little bit of suspicion until I just sit down with them or I talk with them. And of course, it just drops and I see the complete innocence again of everyone and all of our bodies.
Yeah.
How has your experience been in this? And how can people overcome those ingrained beliefs about their own sexuality being wrong?
I think first thing is to actually to see it, to talk about it, to acknowledge it. Okay, so this is how I feel. I feel scared, I feel horny. This is what is. And then what happens is like, okay, do I make a story of it? I think the next step is to accept. Okay, so this is what it is. And not until I can accept it for myself, not before that, it can transform into something else. So acknowledge it, accept it, and then transform it. And when you transformed it into what it is you want it to be, to really include it in your life, then sort of, include it. It comes afterwards, like an integration of what you discovered, how you want it to be. But it's a good thing that he got in touch with you, I'm thinking, and just talking about this is how I feel. For my own sake, or my own experience, I don't have the same thing as you. I have never felt that I can't trust people with a penis. But I have felt the opposite, that I can't trust people with a vagina.
Yeah.
So that's just, based on my own experience and how my environment was when I was growing up.
Yeah.
But I can definitely, I know what it is, what you're talking about, because there's probably more people thinking like you are than I've been thinking. That's at least what I believe. Do I want to say something more about that? I would say that everything is fine always that gives you pleasure are perfectly fine. As long as you're doing it together with someone who also enjoys the way that you want to experience pleasure.
Mm-hmm.
And as long as you don't hurt anyone
Mm-hmm.
or yourself.
Mm-hmm.
Unless, I mean, and someone who's listening to this might think, yeah, but you know, BDSM, and what about spanking? Yeah, but it's always with consent,
Mm-hmm.
with the people you're enjoying it with.
Mm-hmm.
So try to be fine with it. Try to be curious.
Mm-hmm.
And I'm really curious. I want to know, what is it that, you know, is so shameful or so bad? In what way could it be bad? I can't even see in what way it could be wrong or bad.
Definitely. I mean, the world would look very, very different in a very positive way if everyone was relaxed in their genitals and able to receive their own pleasure fully.
Yeah.
So I think we're only creating a more beautiful world
Yeah.
the more we allow our own pleasure. Yeah.
And you know, there are different ways to experience pleasure as well. So I mean, and you or me, if we would meet, maybe we don't match in that way. Maybe you want to have more like an energetic touch, and maybe I want to have more like a firm, steady touch. So it's also about finding out what kind of pleasure my body likes.
Mm-hmm. Definitely.
And I know I'm still learning about myself.
Mm. And there's, for myself personally, I love exploring and finding out what I naturally like, what is easy for me to like. And I'm also really curious to just continuously try and expand my range of what I like and without pushing it, but I'm just so curious. I want to know it all.
Yeah.
Yeah,
Me too.
Yeah.
I think that's something we have in common, that we are so curious.
How can people feel more connected to their genitals on a daily basis?
It's quite easy, actually. If they want to, they can just squeeze a bit. Squeeze and release.
You mean the muscles or with touch?
No, the muscle. You can sit in the office or going on the subway or a bus going somewhere. You can just clench your pelvic area and let go.
Mm-hmm.
And when you're clenching it, you can just put your focus there. And how does it feel when you clench and hold the clench? And just slowly let go of the tension. And so do that a couple of times a day. You'll be more aware.
That's the most simple trick that I would also recommend.
Yeah.
Even if there's a lot of tension, for a lot of people, it's like, but there's already tension. Why would I clench it? But it's often like, it's so much easier to relax after you clench it even more. So
definitely. And what I recently learned is that if we have a lot of tension in our upper body, in our breast musculature, we can't breathe properly. And when we can't breathe properly, the pelvic floor tends to tense up. So if we let go of tension here,
and here is the muscles on the chest,
the pecs, the breast muscles. So if you let go of tension there, the breathing is going to help you to relax the pelvic floor. So when you inhale, and when you are relaxed, the inhalation is going to help the pelvic floor to expand a bit and to move itself downwards.
Definitely.
And then on the exhale, it's going to contract again and go upwards. So this simple breathing, or simple, I don't know, but the deep, slow breaths.
Mm-hmm.
Maybe it also can help you connect to your genitals, because the pelvic, the tissues and the pelvic floor is all connected.
Yeah, I think for a lot of people, just breathing sounds a bit boring, but the breathing is so simple and it's doing so much. And I think also through my studies in osteopathy, I learned how connected not only the diaphragm is with the pelvic floor, but also the floor of the mouth and the jaws. So if we can maybe unlock the jaws when we're breathing, so it can't clench there or hold there, and then we just breathe a little bit, and even with the upper belly, if the lower belly doesn't work, it's like every time the belly is expanding, the pelvic floor is also expanding a little bit. It's one, it's one place that is expanding and moving, and so it's just a little massage that you're giving from the inside out with every breath that you take.
And it's for everybody.
Definitely.
Yeah. If you have a pelvic floor, and most people have one.
Yeah. Okay, last shorter, maybe fun question. I just love the boldness and the cock positivity and your social media content and how you play with imagery also. And I got a question like, what's your favorite representation of the penis in art or history, or like, what's your favorite image of the cock?
Oh, what a brilliant question. I see, wherever I put my eyes, I see cocks everywhere. So I'm not sure that I have a specific piece of art that I have in mind, but I can see it in a flower or in a photograph somewhere. It's just there. Do you have a favorite image?
I just really love the fruit images. Any fruit. Also in Stockholm, there's this photograph museum.
Yeah.
And with our common friend, I went there to an exhibition, and there were so much images of like nature things that are a bit slimy or a bit, it's like a bit oily, and also, follows symbols. I don't have one favorite, but like the nature inspired, little bit juicy pictures are definitely on my top.
Oh, wow. Yeah, I'm gonna continue to look out for these beautiful shapes anywhere. I mean, this microphone that you're talking in right now, it's
definitely,
it's beautiful.
It will do. Linda, how can people find you and your work?
They can find me on Instagram, where I'm called the Naked Coach, but in Swedish, Nakna Coachen. Also have a web page. It's not really done yet, but it's called tantraakademin.se, Tantric Academy in Swedish. I'm also on YouTube. I have this new podcast called The Naked Coach, but in Swedish, the Nakna Coachen.
I'm gonna write those links in the description of this episode so people can find it easily.
Yeah. Perfect. Thank you. Thank you for inviting me.
Thank you so much for your enthusiasm and just generously sharing. And
as I told you, my favorite topic. So, yeah.
Thank you so much.
Thank you, Laura.